Legacy to me, career wise, kind of being known as a health equity expert, leader, innovator, someone who can look at a system and kind of think outside the box and see how it can be scalable, how it
Yeah.
can be reproducible anywhere that has inequities. And like I feel like okay,
Welcome to another episode of Grab Coffee with me, where great conversations and even better coffee meet purpose, leadership, and the people making an impact in their communities. Today's episode is brought to you by Dowden Golf Solutions, transforming corporate events one golf experience at a time. I'm your host, Ian Peterson, so let's jump in. Today, we're heading up to New York City for a conversation I've really been looking forward to. My guest is Dr. Pascale White, gastroenterologist at Mount Sinai Hospital, associate professor of medicine, co-founder of the Association of Black Gastroenterologists, right, and a hepatologist, where we met at the Nexus event in New York City in Times Square, and the director of Health Equity and Action for Liver and Digestive Diseases. That's a mouthful. Dr. White, welcome to the podcast.
thank you so much, Ian, for that introduction. Happy to be here.
I know it's cold up there, and
It's frigid up
I'm
here.
sorry.
Like
Today's
how I warm
there you go.
my
There
stuff.
you go. I don't have coffee, but I just finished my coffee. I'm just finishing up my water right now. But what is your go-to coffee?
Go-to coffee would have to be a throwback for me, a caramel macchiato. The
Love
first
it.
time I ever had it was my first year of college, and it's a very delicious warm drink. Definitely love caramel macchiatos.
And then what is your favorite coffee memory?
I'd have to say Saturday mornings with my parents.
Hmm.
My mother would brew a big pot of Bustelo, and
Love it.
could smell that from all over the house. And I knew it was Saturday. I knew it was going to be a good time with family. And big breakfast is a big deal in our house. So that's a favorite memory of mine.
So you're a clinician, an educator, a community advocate, and a trailblazer working to reshape how communities access care. And that's what I really loved about that ABGH Nexus event, hearing that, seeing that, and hearing those side conversations. When did the community aspect of care, of healthcare, come into play for you in your journey as a doctor?
I have to say during my training at NYU, trained there at Bellevue Hospital, and just seeing how this big, huge place was like, beacon of hope for a lot of people who couldn't receive care around New York City, and having the ability to take care of the most vulnerable populations in New York City was a absolute privilege. And at that point in time, I realized that I had a passion for just kind of focusing on that area of medicine and really honing in on how can we create a system or collaborate on creating a system that could have more equitable care for everybody, regardless of their ability to pay.
Yeah, great. So you built a career at the intersection of clinical medicine, academic leadership, and health equity. What moment or experience helped you realize that your path in medicine would ultimately include leadership beyond patient care?
There are many different moments in time. I'd have to say when I was selected as chief resident for the outpatient clinic at Bellevue was when I realized that not only can I impact patient care, but I have the ability from an administrative standpoint to impact workflow, scheduling, seeing how we can triage patients who need to be seen faster, and how my input in that can make a huge impact downstream on patient care and outcomes. So having that experience kind of led me into the path of becoming director of GI clinic here at Mount Sinai. And that's a position that I held for about 7 years prior to my current position as the director of health equity. But it was that moment where I realized that being a chief meant that it's not only your clinical skills, your teaching ability, but how are you going to use all of this administrative resources that you have to really make that impact on your teaching and your clinical care.
And you're in an industry where it's really life or death, right? So there's a lot of pressure, and it requires teamwork under pressure. What have you learned about leading multidisciplinary teams that business leaders outside of healthcare could benefit from? Because we kind of look at it, we all have fires that we need to put out, but again, it's really life or death in your industry. How can others like my learn from the pressures that you guys are under and that we could benefit from in leading teams?
Every specialty has their own culture. How do you merge them so that everyone can be on the same page? How do you um, find a common good, or like I say, a common enemy, right? What are we all working towards together that we can all build upon our skills and resources to do that? And what can we kind of see is, or the obstacles that are kind of like getting in the way of us creating this common goal? But everyone wants to be heard. At the end of the day, everyone wants to be seen, everyone wants to be heard, everyone wants to be appreciated and respected for their work. And I think that when I was in business school, we learned that culture is going to eat strategy, for lunch, right? You have to
Yeah.
learn about the culture of each of your teams in order for you to kind of progress towards that common goal.
Yeah. So you've been deeply involved in addressing disparities in GI care, especially in underserved communities. What's one misconception people have about health equity work, and what does meaningful impact actually look like to you?
That was a great question. I think the biggest misconception is that just identifying the inequities are enough. Like, we've identified this disparity or we've identified this inequity, and it's like everyone's like, okay, great. What are you going to do about it? And I think that that's where the heavy lifting comes in. I think that is kind of identifying not only what those disparities or those inequities are, but also coming up with a very intentional plan on how you're going to address them, and not only address them, but also to track your progress.
Yeah.
And that's hard to do when you don't have the data. So when you're having to tackle an equity issue, not only do you have to think about how this is going to be followed and tracked downstream, but you are going to have to realize that you're going to track the things that you find the most important, but also come up with things that you didn't realize were the most important things to track too. And there's a lot of intersections and overlaps with a lot of the inequity issues in GI care, especially, for example, when you talk about colorectal cancer screening, right? You're talking about screening and prevention, but inequities kind of travel down that continuum. And so when you're thinking about programs for screening, you also want to also think about ultimately how is it going to impact how people are treated, the diagnosis, the follow-up. So it's very complicated. And I think that people oversimplify just identifying the problem
Mhm.
as, oh, we're doing health equity work. No, it's larger than that. And you have to create your own kind of ecosystem and teams that are going to be good at that. So everyone on the team has their role to play. Whereas one person can say, I can identify the inequities in this data set, another person on your team is going to say, and we're going to build this infrastructure to scale this program. And then you have someone else that's going to say, I'm going to track this data and we're going to create this dashboard. So everyone has to kind of work together and give their input because it's just not a one and done thing.
Yeah. What are some emerging trends or innovations in healthcare that excite you most that you see coming down the pipeline?
Ooh, like I said, I have built my career on just looking at access to screening, colorectal cancer
Mm-hmm.
screening specifically. And there are a lot of new screening tests that are coming into the pipeline. I may have heard of new blood-based colorectal cancer screening tests that have been approved recently, and how that's going to impact patients who otherwise would never have gotten screened. And so I'm excited to see how people who never thought about getting a colonoscopy, or people who never thought about collecting their stool to do a
Yeah.
screening test, and
Mm-hmm.
everyone's
Mm-hmm.
used to getting their blood drawn since they were like
Yeah.
kids. How is that going to impact people's willingness to get screened for a preventable disease? So I'm most excited about that right now.
There's a growing movement of doctors leveraging innovation, business strategy, and partnerships to create new models of care. How do you think entrepreneurship fits into the future of medicine, and what role do physicians themselves need to play in that?
Fantastic question. I think when we're in medical school, we're not focusing on necessarily building businesses and
Yeah.
innovation. I think this generation of doctors are different because we have AI and we have to incorporate what that means in their medical training. We have to have a different mindset of how we are contributing to a lot of the new innovations because we're in the trenches, we're at the front line. So we know what our patients are struggling with. We know the obstacles that we are facing when we're trying to prescribe medications or when we're trying to do a particular procedure and say, wow, I wish I had this particular tool. It's taking that step from thinking about and identifying the problem again to finding the resources to how to solve that is what we were never trained to do. And so going, let's say, for example, from having, let's say, polyp detection, we are trained to find polyps with our own eyes, but now we're using machines to help us do that. Who helped develop the machine to
Yeah.
do that? And who's going to have the machine think about the biases that we should take into account? Like, that's not a polyp, that's a piece of stool.
Yeah.
Who's helping at the background of this innovation? And I think that's where doctors have to step in because of our experience, our lived experience, and our training to be able to contribute to a growing field such as AI and how it's going to ultimately help us and help our patients.
Yeah. Great. And you've done a lot of mentoring. You've yourself been mentored.
Oh, yes.
What leadership qualities do you believe today's young healthcare professionals need most, and how do you intentionally cultivate them?
So I grew up differently. We grew up very different. I didn't have social media when we were growing up. So I think the biggest thing right now is communication
Hmm.
because at this point in time, social media is kind of teaching our kids that we can take snapshots of information in like seconds and try to fit it all in when sometimes it takes longer than that. Or even like COVID. COVID taught us that we could deliver medicine through a screen, right? But the art of communication, literally a course when I was at GW, the art of medicine is communication. And I think that we have to be able to leverage what we have now at social media to our advantage to give those snapshots, but also be able to kind of pivot and step back and say, we have to go back to the old school traditional eye to eye, face to face, sitting down with your patient and being able to connect in that way. But the communication piece is key. I think it's a lot of people have a lot of information, but the trusted sources that we are seeing in the community as being, we have to kind of uphold that. And communication is definitely something that I want to teach my trainees and my mentees that there's no substitute for sitting down with your patient, even if
Yeah,
we have all these resources.
exactly. There are some things you just cannot replace in life, and communication is one of them. That's great. Medical leaders frequently face emotionally and operationally complex decisions. Is there a decision in your career that shaped you as a leader, one that taught you something that you carry into every role that you're in today?
Like a decision, you mean?
Yeah.
I think I remember the day that I went and spoke with my husband about this. It was in the middle of COVID, and I was like, I want to go back to school. He was like,
Yeah, yeah,
what?
yeah,
Being an adult learner is so different nowadays. And I think the decision to go back to school to get my master's in business and get my master's in science and healthcare policy and research and leadership was a pivotal moment for me because I could have chosen to do a lot of different things. But seeing that there were areas in my prior education that were blindsided. Like, how do I think about solving this equity issue when I'm not sure about the business model that's driving the decisions that my administrators are making? These are conversations that I can have toe to toe, right, with these
yeah.
administrators now because I have that insight. I have that piece that was missing as to what they were thinking about. But I also have my eye on my patients and I can bring that to the table and make and humanize the process and humanize those decisions. But going back to school, the middle of COVID, getting an MBA and a master's in science, a dual degree at Cornell was, I think, a game changer for me, for sure.
Right, because I wanted to get more to you personally, right? So, like practices and boundaries that help you stay grounded and aligned, with your purpose, and that kind of goes well to what you just said. But what practices help you stay grounded? You help a lot of people, but what about Pascal? What about Dr. Pascal White? What helps you stay grounded?
All right, so I have non-negotiables. I tell this to all of my mentees.
I
You got to
like it.
have
I like it. I like
non-negotiables.
it.
Okay. I have to get between 6 to 8 hours of sleep.
Okay.
I kept that rule in med school. I definitely need it now. Got to get a good night's sleep. I have to get some form of exercise, and golf counts in the summertime for sure. Okay. And I have to maintain my spiritual routine in my activities. And that is a huge part and core of me, of who I am. And so meditating on my blessings and being grateful for my privilege of being here in my position, and not even as a doctor, but my position on this earth and my family as a sister, as a wife, as a mother. Meditating on that piece of gratefulness has kept me grounded, because every decision that I make, you're saying no to something else. And so every time I have to make a decision or a commitment of my time, my energy, I have to think about, the first question is, what is my bandwidth? What is my time? That is, a non-renewable resource, right? I have to think about my yield. Is it a professional yield? Is it personal yield? Is it my passion? If it doesn't fit in those three buckets, then, I have to kind of think about what my boundaries are with that. And then lastly, it's kind of like, what is the sacrifice? What am I saying yes to that I will have to say no to later? And if those things are not fitting and jiving with my spirit, then I have to either decline or, have to, defer, whatever that is. But boundaries are key, because you can easily burn out. And people use that word and throw out,
Yeah.
burnout all the time, but that's a real feeling. It's a real thing. And I try to uphold those boundaries in order to prevent the effects of burnout.
Love it. Mention you mentioned golf. This is not a golf podcast.
It is not,
Yeah,
but
yeah.
I love it so
how's
much.
your how's your golf game coming? So how's your golf game coming?
My
How's it coming
golf
along?
game is very much at the beginning stages. I've seen a meme that was so funny. There was a meme where, there's a guy standing there and there's different things about how he can improve his golf game. And there are things that go by that says lessons, practice, and then a new golf bag comes in, or new irons. And then he chooses the new irons instead of
Yeah,
the lessons and the practice.
just
That's me. That's me. Um, but very much a beginner, but very passionate about the game, because again, it gives you a time to kind of reflect, and each position matters. Each stroke can lead you in a different direction. And I kind of like, I made that analogy with life, right?
Mm,
The decisions that you're making, the long game, your short game, all of these things are just analogous with life. And that's why, I'm just so grateful to my brother who introduced me to the love of golf, and very much eager to learning more about it and getting more people to play with me, which is why we brought you into Nexus, right?
exactly,
Nexus
exactly.
is a
It was great.
is a place for Black women to kind of get to know
Hmm.
each other, to network, but to also discuss topics that are important to us in medicine. And it's important for us to kind of build up our skills outside of the walls of the hospital. And golf is one of those things where you can make these connections and these analogies to your life and the way you practice. That why I brought you all in. And my
Hmm.
co-directors were like, they saw the vision and we went through it, and it was a phenomenal time.
Yeah, definitely a great experience. The conversations from that experience, and seeing the joy when someone finally hits a golf ball and then consistently hits a golf ball, and it's our goal to introduce people not only to the game, but we also want them to continue to play. And we hope that we did that. But tell us more about your shirt. We see that logo on your shirt there. What does that say? The Ryder Cup?
It says the Ryder
Bethpage
Cup,
Black.
Bethpage
Yeah.
Black, a phenomenally hard course. People can't even get, tee times on that
Yeah.
course. They come from
Yeah.
all over the world to play it. I was so grateful to my brother who got tickets to the Ryder Cup for us this year, and
Hmm.
it was a phenomenal time. It's a very interesting sport. You're quiet in some places, you're very introspective, and then even you're not. So every shot is different, but the Ryder Cup was a special time to spend with time with my brother.
Jealous. I wish I was able to make it. I was up there during that time, but I wasn't able
Were
to
you?
make it to the Ryder Cup. Yeah, had some other things going on. But looking ahead, whether in healthcare, leadership, or community impact, what's the legacy you hope to build, and what excites you most about the next chapter of your career?
That is a phenomenal question. Legacy to me, career wise, kind of being known as a health equity expert, leader, innovator, someone who can look at a system and kind of think outside the box and see how it can be scalable, how it can be reproducible anywhere that has inequities, kind of coming up with a process, what that process is to make a golf analogy, get on green every time.
Yeah.
So being known for someone who advocates for their patients, someone who is just a real passionate leader about patient care and equitable access for that care. Family wise, though, I can't leave, can't ask me about legacy without thinking
Yeah.
about my family.
Exactly.
Um,
Exactly.
my parents, Haitian immigrants coming here from Haiti when they were young and having myself. I'm the baby of the family, by the way. I'm the medical doctor. My brother's the eldest.
Yeah.
He's an attorney and a
Oh,
lobbyist. My
nice.
sister's
Uh-huh.
the middle child. She's a PhD in English, professor. And I'm the baby. But all of us in common, that education piece, that legacy of education was there even before my parents. It was their parents. Like, so leaving a legacy for my daughter, for my nieces, to say that education can not only open like doors, but it opens windows. It
Yeah.
opens places that you never thought that you would go. And I hope that my daughter can see this and my nieces can see this and really be proud of the fact that not only myself, but my siblings and my parents, we really honored, the aspect of working hard and getting an education can lead
Mhm.
you to the places where you never thought you'd be. So I'm grateful that it's a privilege, honestly, to be where I am and to help others. I want to make sure that my daughter and my nieces can see that as well.
That I was going to ask you to leave us with a gem or message to my audience, whether they're now in medical school or they're in a community looking for some sort of help. But I think, unless you want to share something else, but I think you covered that there with that education piece. But I don't want to take up too much of your time. So I want to thank you, Dr. Pascale White, for joining us. I thank you for joining me with for a virtual cup of coffee. And to my audience, thank you for listening to another episode of Grab Coffee with me, caffeinated by Dowden Golf Solutions. And if you like this episode, don't forget to like, share, and subscribe on YouTube so you don't miss what's brewing next. Until next time, keep your coffee strong and your conversations meaningful.